agenda is a motion to approve conduct of meeting by electronic means. Ms. Franklin, could you make that motion?
I move that the items on the meeting agenda constitute essential business of this board. Meeting electronically is necessary to protect health, safety, and welfare of Tennesseans considering the COVID-19 outbreak. And any conflicting with the governor's executive order permitting electronic meetings be suspended.
Is there a second for that?
Second.
All right, I saw Mr. Fredericks. All right. I have to roll call. So, Ms. Franklin?
Aye.
Dr. Smith?
Aye.
Mr. Frederick?
Aye.
Dr. Campbell?
Aye.
Ms. Etherington?
Aye.
And I also vote. Okay, thank you. The next item on the agenda is consideration of extension of a public health emergency declaration. To make you all aware, public health emergency declaration is the umbrella in which all of our orders have been implemented. It's currently set to expire on December 31st. It is my recommendation, I'd appreciate a motion to this effect, that we extend this public health emergency until the last day of March, with the understanding you can always rescind it if this pandemic crisis seems to have remedied by then.
I'd like to make a motion to extend the period of emergency to the end of March.
Thank you, Dr. Smith. Would there be a second for that?
A second. Second.
Dr. Campbell. All right, roll call. Dr. Smith?
Aye.
Mr. Frederick?
Aye.
Ms. Franklin?
Aye.
Ms. Etherington?
Aye.
And Dr. Campbell?
Aye.
I also vote aye. All right, meetings from November 12th were circulated, the meeting minutes, excuse me. Anyone have a chance to review those and make any comments or anything beyond that?
I would move approval of those minutes as distributed.
There's a motion from Mr. Frederick. Is there a second for that?
Seconded.
Okay, Mr. Smith, Dr. Smith, excuse me. All right, Dr. Smith.
Aye.
Mr. Frederick.
Aye.
Ms. Franklin.
Aye.
Ms. Etherington. Carol, vote yes or no? Aye. Aye. And Dr. Campbell.
Aye.
And I also approve as noted. Thank you. Mr. Diamond, the next two items are yours, sir.
Yes, Dr. Jahangir, we do not have any applications this month, so I'll move to the contracts portion. There were a total of 5 grants and contracts up for your review and approval. 3 were in the initial packet, and 2 additional ones that were added today.
Hold on, Mr. Diamond. Can you please mute if you're not speaking? I know we've all done Zoom for a while now, sorry, Mr. Diamond, go ahead.
That's okay. I apologize. We had 3 in the advance packet and 2 were sent today. Item number 1 is a private foundation grant for MAC, and it's an adoption initiative for $7,500. Item number 2 is partial funding for the Air Pollution 105 grant, $117,000. Item number 3 is a BAA with AMOCA, which is used for our TB program where they do telemedicine with some patients. Item number 4 is a POD contract with Vanderbilt. And item number 5 is our HIV prevention services grant for calendar year 21. So I'd be happy to entertain any questions. If not, somebody could move to approve if they so feel.
Move to approve.
Seconded.
Okay. So, yeah, all right. So Carol approved today. I think I initially saw a second. Any further discussion around the contracts and grants? All right. Hearing none. Dr. Smith.
Aye.
Frederick.
Aye.
Ms. Franklin,
Aye.
Ms. Etherington,
Aye.
and Dr. Campbell. And I will also approve these. Thank you. Next topic is the report of the director, Dr. Caldwell.
All right, good afternoon, everyone. In addition to what's in your packet, I have a couple items that I'd like to bring up to you, and we do have some other colleagues who are plugged in, IT Director Keith Durbin. As you know, the data sharing has evolved into the final plan, and I wanted to update you to let you know that the data is being gathered and a system is being put in place with our chief epidemiologist, Dr. Rand Carpenter, and IT, and we'll be reaching out to Dr. Tom Campbell, who headed up that committee with the community to go through these numbers and develop an auditing process, which will by January have an initial report to provide to the board, and then we'll be able to provide that on a monthly basis for review and discussion. So I'll see if you have any questions on that. Okay, thank you. I'll go on to the next topic. Next topic is Dr. Jahangir. I just gave you a sort of a handwritten draft of a memorandum of understanding that I'm proposing. Just for the board's knowledge, there was an IT leadership position that was transformed from the former deputy finance manager position. I've been looking at that and reviewing it with Metro IT leadership, Keith Durbin, to see how we might be able to create a partnership that really will strengthen both our health department as well as Metro IT. And there is a proposal that initially we have a memorandum of understanding between the health department and Metro IT for this leadership position in a contractual form for 6 to 12 months. At that time, then we will be able to make a better decision moving forward on what the needs are for the department and how we could coordinate better overall with Metro IT. So, Mr. Durbin, if you might just want to speak to your thoughts on the value that you believe this has for the health department as well as Metro overall. Thank you.
Sure. Thank you, Dr. Caldwell, and thank you to the board for allowing me to speak for a few minutes. So I've been speaking with Dr. Caldwell about the arrangement that he mentioned. An MOU between the ITS department and other departments and agency is something that we've done multiple times for basically this same purpose. We have done MOUs with the Public Works Department, with the Fire Department, and with OEM that seek to come in with ITS staff, come in, first do an analysis of what is going on in the department. And in that analysis, we identify and look at certain things. What are the unmet needs within the department? There's some process flow with regard to systems as well. It's documentation of those systems or reviewing the documentation of what systems are in place, what interfaces to other systems exist within Metro and without. It looks at what industry standards are being followed or not followed within the department along the IT, as well as what Metro standards exist, because there are custom Metro standards that our department leads for other departments and agencies around systems, around operations, and very critically around our security posture and making sure that there is a standard that's followed across Metro departments and agencies. And then through that analysis, which takes months, it is not a fast or easy thing, especially with an organization as large and complicated as the health department. We then work with the department and provide a technology roadmap, including expenditures, including staffing, including security recommendations that we then present in in a documented official form to your department. What is a little bit different about this one is that that is similar to others, but is somewhat unique to this one, is that we are also planning to work with Dr. Caldwell to help find in a contract position this IT manager. We would work with your agency to hire that person, as well as to manage that person through the course of our MOU. That person would be intimately involved not only with managing the staff. I think there are 6 or 7 IT oriented staff within the health department, but also they would be intimately involved with that analysis, which is a great opportunity for that person to come in and really do a deep dive and understand the lay of the land. And over the course of that 6 months, 12 months, really get a good feel. And then at some point in the future, we would recommend posting that position and bringing somebody on full time. I'm happy to answer any questions about what we've done at either in other departments or agencies or similar MOUs, such as we have one with the planning department right now where we are managing Metro's GIS, Geographic Information Systems, and staff and systems as well. And it's something we're very pleased to do because we think it's important.
Thank you, Mr. Durbin. I'll ask Dr. Jahanger to moderate if there are any questions on this.
Yeah, I mean, I guess my only question is, what action do we need to do, and how quickly would you? It sounds like from an IT standpoint, you think our department is one that probably needs this role. Is that what I understood you to say, Mr. Durbin?
I do think your department is too big and too sophisticated not to have a dedicated IT manager at whether it's an assistant director level or something close to that. This is not casting aspersions on Mr. Diamond, who we worked with very successfully for years. But I do think that as someone dedicated with 7 to 10 years of IT management experience, we're in Nashville, so potentially someone who has healthcare experience could help elevate the level at which your organization operates.
Thank you. And Dr. Caldwell, based on our conversation we had about this, whenever time that was, it sounds like you know of a way you could do this in a budget neutral fashion. Did I understand that right from our previous discussion?
Yes, thank you for bringing that up, that there's already a funded position for this. There's a freeze now because of the budget. We are expecting that freeze to be lifted. And since half of the year is already over, there are funds once the freeze is lifted or we get permission from the mayor's or finance office that can go to this position at least through July 1st, and that then the budget year would then continue that. So I feel very confident that this would not require any funds, but it would really provide tremendous value and a new pathway for us to help organize the department, but to initially do that ascertainment assessment. And now also a great new addition to have a strong linkage and partnership with IT. I'm really grateful to you, Mr. Durbin. I know that this has also been brought to Derek Smith's attention, and he's in the process of looking at the details of it to see if, in fact, the MOU might need board approval or not from a strict sense. Typically, MOUs between government agencies that do not include transfers of funding of any kind are not required to be approved by the board. However, the board always has in its purview to approve whatever it chooses. But just so you know, practically, contracts like that would not need to go through council or anything, because we do have our own money for it here at the health department. So the MOU would be for the relationship, and we would pay for it. And I'd ask Mr. Durbin if the way I've just described it is the correct, if I've misstated anything.
No, Dr. Caldwell, that is correct. There is no transfer. It would be a contract position paid for through your organization. And just to be clear, there is no charge, no additional internal service fee or anything like that from ITS for the service of managing this person or leading this assessment. And this assessment will involve basically every one of the divisions of my organization, just because there are so many interface points all throughout our organization with your organization. But there is no charge for the work of our staff.
Okay, thank you. Carol, and then maybe we think through this a little bit further. That's my last comment. Is I appreciate this. I think it's worth thinking through a little bit and talking about it more, Dr. Caldwell, before action is taken. And Carol, I saw your hand up.
Yeah, I did a question for you, Keith. Sounds like a lot of the departments or whatever departments have had good experiences with it. What glitches or downsides have they experienced? And for Dr. Caldwell, I'd like to know what our MPHD IT folks, how much involvement have they had in the discussions, and are they supportive of this?
That first question was for you, Keith.
Okay. So I am not aware of glitches or downsides. I will say that it is not always necessarily very welcome by the IT staff, because we are coming in and evaluating them. We are evaluating them, the work that is being done on standards. We are not trying to tell them what they are doing unless it is something that is a recommendation. Glitches we have had, if there are not funds available for some of the remediating actions, that has certainly kept some of the recommendations from being in place, because again, we're looking at a long-term roadmap. For instance, in the Public Works Department, we recommended replacement of a paving system. That was 3 years ago. That paving system, due to budgetary considerations and other things, has not happened. So we are not looking to have an adversarial relationship with anyone. This is meant to come in and help an organization understand what their potential and meet that potential. And that's what I can think of at this point. This is a good question.
Yeah, thank you, Mr. Durbin. I can tell you, Carol, that I've had conversations with Jim Diamond about this, and we've had conversations about different options. I have not specifically had detailed conversations with each of the IT staff, but Jim as the current leader there. And there are a few things historically that I have learned that I feel there needs to be a stronger partnership with Metro in this way to help us make sure that things are not missed, not have problems, to look for things in advance. And there's some concerns that I've had with some things in the past, and I think that the coordination is such that Metro IT brings that to the table, makes me most comfortable as a director of health to go in this direction. And I'd also say this is not an irreversible decision. This is one that we are sort of, as Keith likes to say, try before you buy. So I would reassure you, Carol, that if we and the board feel comfortable moving in this direction with this contractual relationship, and it turns out that it's not working well, we want to do something different, and we have the option to do that. So please know this is a good opportunity for us to be creative, try something new. Maybe, go ahead, Mr. Durbin.
Well, and I just want to state one other thing. So 15 years ago, Metro was at a different place. There were a dozen different networks. There were 20 or 30 different email systems. It was all over the board. And there was a major IT consolidation at that time. So we have one network. We have just a couple of email systems. We have centralized things, which is industry best practice. So one of the things that staff in some of these departments may think is that we're trying to come in and redo this consolidation and consolidate even more. That could not be farther from the truth. One of the aspects of that consolidation is for software systems that are vertically oriented toward a department. Health department systems need to be run and operated by people in the health department. We're never going to be experts in PTB-MIS. We don't want to be, and we can't be. So there is always a place in departments for people that are doing the roles you have now. What the goal is to come in and advise on all those surrounding things that are the common services that everyone has. Are security being followed? Are you taking advantage of tools? Are you taking advantage of services that we provide centrally? It is the opposite from trying to pull people from one department into the other, unless it's a situation where a department feels like, hey, this fits better in ITS as a central enterprise service than it does with us.
All right, I appreciate this. I think let us process this if we can, at least the specific part. And I'm grateful for you, Mr. Durbin, as always, for providing some insight. And Dr. Carl, maybe we can move on to the rest of your report.
Yes, thank you. Thank you very much. I do want to call on, I see Tina Lester. We have infant mortality review update with Deanna Allen-Robb.
Okay. That presentation has been moved to January, so we won't have that today.
Oh, well, okay. There you go. Well, thank you, Tina, for clarifying that. Well, I'd also just like to let everybody know that we're so excited about the developments with the vaccine that are being planned. We're hoping that they start coming in next week. We've been doing a lot of planning. We have new freezers, so if you do get a chance, and if some of you are here at the health department, I can show you the new very super cold freezers where the Pfizer vaccine will be stored. We're going to be partnering with new partners to help vaccinate our first responders. So we're ready to work with the state of Tennessee Health Department and all our other partners to get people vaccinated as soon as possible. Our goal is to not have any vaccine in storage, but to, as immediately as possible, get it into people. And Dr. Jahangir and I and other colleagues met with the Unified Command at the Tennessee Department of Health and got an update on the whole vaccine distribution across the state. I was very pleased also that they're using the CDC system for the social vulnerability index. You can find it at CDC SVI if you Google that, to see a map, which is really extraordinary. You could zoom right down to Nashville, Davidson County, or look across at the state of Tennessee. And what they said was great news, that they were not going to just distribute the vaccine on a population basis initially until there's a lot of it. They're initially also going to look at the social vulnerability index, so that if there are certain communities across Tennessee that are determined to have a higher degree of vulnerability, that they will be allocated additional doses just because of those two factors together. So really wanted to make sure you were aware of that Equity is taking a really frontline status with looking at vaccines. We have already been focusing on equity throughout Nashville, Davidson County in our testing. As you know, we do have the three usual sites at Nissan Stadium, the OK Mart at Murfreesboro Road and Meharry Medical College. But we have adopted these mobile testing in areas where we know there is greater need. We had a wonderful event at Plaza Mariachi a few Saturdays ago in partnership with Lipscomb, Meharry, and ourselves. We did COVID testing, flu vaccination, and a number of other programs. So we're looking forward to recreating that event again. So I'll conclude my report there and ask if you have any specific questions on any other programs that you're interested in knowing more about. So thank you.
Any discussions, colleagues? Okay. All right. Hearing none, we'll move on to the other thing. For those of you watching, I'm not trying to print paper, so I'm looking at my computer. It is the discussion of the Metro HR fact-finding report. So listen, I want to take a minute to just say this. We all realized that this is a really stressful time for public health, but as I said this morning at the press conference, it should not take away from the fact that we must treat all our colleagues with dignity and respect. You know, we have over 700 really amazing individuals at the public health department that I've had the opportunity to meet, not all 700, but a lot of them. And what I've noticed is we, especially as a board, are committed to making sure that these individuals have a safe and healthy environment every day when they can come to work. So when I received this complaint against Dr. Caldwell now at the end of September, I took it very seriously. I immediately sent it to the appropriate channels, who then launched an investigation. And they launched an investigation through a process that I expected to be conducted professionally, independently, and fairly. So after nearly 2-month investigation, I do believe that Metro HR did adhere to the expectations that I said above. Once this investigation is completed, I received their report on Tuesday. And that afternoon, Dr. Caldwell and I did meet, and we went over the report and discussed it. And now it's here on our agenda this afternoon to discuss as a board and decide what actions need to be taken. Now, I want to highlight again, I think it's important to have a fair process, and that's what we're doing here. I wanted to make time for dialogue and open dialogue about that. I want to say this, I've been really amazed by the great individuals at Metro Public Health. They've dedicated their lives to keeping fellow Nashvilleians safe. And right now, they're literally in the middle of a fight against a once-in-a-lifetime pandemic. So I want everyone in the department to know that as a board, we find that one of our largest and most important responsibilities to ensure that you, as the hardworking men and women of this department, have a safe and healthy work environment, period. And that's why we're here today. And with that, I want to actually give Dr. Caldwell an opportunity to address the report. The report has been circulated, just so that everyone knows. The board's had a chance to read it. Obviously, it's public. And with that, I want Dr. Caldwell to make any comments he'd like. And then I would like to then proceed with the board having dialogue, and any questions or comments are free to be made. So Dr. Caldwell, please, the floor is yours.
Thank you, Dr. Thank you. I also believe that safety and health are of paramount importance. Every Friday and Saturday night and Sunday, I work with teams across Nashville, Davidson County on the compliance checks. And those who work one-on-one with me know the first things I always say to them: I care for your safety, I care for your health. So I carry those core values with me every day with everything I do. Let me start by saying I am extraordinarily sorry for the distress and hurt I have caused to those involved, to the department, and to the community. I am sorry that we have to spend some time here today having to focus on me and my behavior rather than on helping our city manage through this horrific pandemic. I am grateful to everyone who participated in this process, and I am thankful that this has been brought to light. I accept full responsibility for my actions. I am willing to learn and want to work to repair the damage done and move forward. As the fact finders concluded, I have acted with an unconscious bias against women. I ask that you focus on the actual findings in the report and know that they have shaken me to my core fundamentally and changed my point of view. This is a wake-up call for me, both personally and professionally. For the first time, a few weeks ago, a colleague mentioned to me offhandedly that some people felt I preferentially called on men before women in meetings. I had never thought about this before. I immediately accepted this and have since consciously focused on running meetings in an unbiased way. I have also noted that a couple of the staff in the meetings went out of their way to thank me. They said they felt something different in the meetings and they really appreciated it. When something is brought to my attention, I make changes and improvements results. Before this current set of circumstances, my bias was not something I had ever been made aware of. Now that I am aware of the bias, I am fully committed to working on myself, both personally and professionally. Metro Human Resources is working with me now to put together both personal and professional development programs to assist me in my efforts. I am confident that this will make me a better leader and a better person. I believe that I am redeemable. My proposed organizational chart contemplates 5 senior leaders, 3 of whom are women. 3 of 5 leaders in my proposed organizational chart are women. Please note that these 3 senior leadership women were not interviewed as part of this investigation. I do believe that these women's voices should be heard as well. Now is too soon to ask for forgiveness. I want to show that I can change and grow and be redeemed. I hope that I am given that opportunity to do this. And I am asking you for that chance. Thank you, Dr. Jahangir.
Thank you, Dr. Caldwell. The floor is open for any of my colleagues. Please maybe just let me recognize you. So either by show of hand or say something. The floor is open. Okay. Is there any discussion, any further discussion then around this? Well,
I think just maybe give us a moment and let's be comfortable with silence.
Yes. I have a question, which is, could we have a little more detail specifically about what sort of remedial plan the HR people are planning on or suggesting putting in place? I'm unclear about the details.
Sure. So I'll tell you what I've learned from HR and Dr. Caldwell. I would also like for you to say, if you said you've had conversations with HR, I'd love to hear what they've suggested to you. My understanding from HR, and again, I apologize, I'm off camera. I'm going to look at my other screen. Is a couple of specific resources that are being proposed is to include a custom executive touchpoint sessions with other Metro executives who specialize in diversity, inclusion, and equity, as well as the possibility of Dr. Caldwell attending executive leadership training sessions with Metro's diversity consultant, And these sessions would include an emphasis on unconscious bias and conscious inclusion. Additionally, it is suggested that Dr. Caldwell pursues professional executive coaching sessions that specialize in this area. And this will be conducted with an independent third-party person. I don't know details who or when or how or already paid for, but that's what we've gotten, what I've, as your board chair, have from Metro HR. But Dr. Caldwell, if there's something more that HR told you, I'd love to hear about it.
Well, Dr. Jahangir, you provided a very full review of what I know right now. I have had direct discussions with Director Shannon Hall, and I would not be here today asking you for an opportunity to move forward if I did not believe that she, after reviewing this report and signing off on the report, believed that this was the right pathway for the board to consider. And
Can I interrupt you? I'm really sorry. I don't think we can project what Ms. Hall does or does not think, because I don't actually know what Ms. Hall thinks, and I've had a lot of conversations with her. So I just want to put that out there for the group.
Okay, I will then rephrase that and say that I have the sincere belief that the programs and experience of HR in general is providing the professional advice and thought about what has happened and what can be done, and that it is something that is redeemable, and at least the report notes that. So I'll just refer that to you to look at the conclusions for that. So thank you.
Dr. Caldwell, have you, in your past experience and career, have you worked in an environment that has addressed these issues with employees?
Could you clarify your question? Have I worked in an environment that has addressed?
Yeah, during your career, have you had experiences with this kind of situation that you find yourself in?
Oh, no, absolutely. So, yeah. Nothing like this has ever been brought to my attention. I have always been very focused on equality and diversity throughout all of what I do. In my career, I could point to a number of specific situations that include racial, ethnic diversity, including gender diversity, and it's always been a priority for me. So it was extra painful for me to hear this, to see it, but I can say to you that once I read the report in detail, and I spoke to a couple of close colleagues who opened up to me that had, were mentioned in the report. And I could share one thing with you just most recently. I said to one of my colleagues, I said, do you believe that I treat women differently than men when I talk to them? And this gentleman colleague said, yeah, I do. And I said, I didn't realize that. And he goes, well, we just kind of never told you. And I said, well, now I know. And he assured me, he said, Dr. Caldwell, I can assure you that if I ever notice anything that, you've done, I'm going to bring it to your attention right away. So there's another example how I've made an improvement. I made a change. I'm going to change the culture of how there is an ability for people to engage me. And I see that a lot of, from the report, where people, it seems that maybe felt they were not able to share their thoughts with me, and that's got to change.
But I'm asking you that in your past experience, in your work experience, in your career, have you not worked in environments that have had these kinds of issues come up? And if so, could you just talk about how that was dealt with or what your role in it was? Not necessarily you, but you were a director of the public health department in another place and you in leadership. So has this occurred before with other people? And how do you?
Yeah, no, not in my experience. I could say only things that I have seen or read. I know that over the last 5 or 10 years, other organizations that I have been in, there's been a greater emphasis on the issue of unconscious bias, definitely from a racial perspective. But no, I have had no experience in this or nor saw it being handled. I guess if it was done in a HR personal confidential way that it wasn't public.
So if we are going to move, if we do decide to move forward and you go through these HR courses and the training, how will we know what the measures of success are? It sounds as though there are many relationships that you need to mend, some outside the department as well as within the department. So we would have to have a definitive way of defining success. And this seems like a very difficult situation for us to come up with strong metrics. And I think that we would have to have demonstrated success in this in order to move forward.
Yes, that's an excellent point, Mr. Frederick. And I would have to identify those metrics and provide them to you that you would agree and think those were correct. So I don't, but I can think of some things, but I would rather work with the professionals to identify the best way. That's something that's already been tested and would be more authoritative.
Yeah. So have you, in your past work experience and your professional experience, ever had situations where your combative nature was called out? Because it does seem that that may be the root of a lot of the problems. And how does one change that?
Yeah. Well, I didn't mean to say, actually, no, my combative nature has never been specifically called out. I think that sometimes I do get impatient when there's a need to make a quick decision and there's an urgency, and I might cut somebody off before they finish their thought. And I think I have always been known to be quite thoughtful and listening. And then once I do make a decision, I then become more clear about now we're going to move forward. So nothing in my past has ever come up like this at all.
So what about your experience here and the culture here and what's happened has brought this out? It's odd to me that this would only be coming out now unless there's something that has triggered it. Is there something that needs to change?
Thank you for expressing that. And I would draw your attention, if you do get it, when you do look at it in detail, to note some of the time frames of when some of these situations were discussed. They were very early on in my tenure. And I do know that, yes, early on I was, as you know, came in for my orientation the day of the tornado. I was working at the Emergency Operations Center, trying my best, as always, to handle the emergency with getting to know the department. And there were a few instances where something unexpected happened, as there always will be. But as I was still trying to get to know our colleagues, I was trying to make decisions in very quick ways. And I think that also exacerbated some of the perceptions, conflicts, feelings because I'm giving direction to people I really don't know very well. Now, here we are 9 months later. It's a different place. We know each other better. And as I mentioned, as I've identified ways that I can make improvements, they're being made. And I know the department better than I've known. I know our staff better than I've known. And I know there are 700 of you, public health staff, that I am so grateful for. And I do my best to get to know each and every one of them.
Dr. Caldwell, can you speak to whatever plan you might have in place to try to restore the confidence of those that have filed the complaints that have been investigated in terms of the allegations of retaliation and things of that nature? How do you plan to restore their confidence and the confidence of others who may not have been directly affected but saw all these outcomes and felt a certain way about it?
Thank you, Dr. Smith. Yes, well, in one of the instances, I was very unhappy about an outcome, and I did immediately go, as protocol, to our HR team. And in discussions with that team, I decided on a different path. So while I might have thought, oh, wow, something's got to change immediately, and I had voiced that, I never directed that should be done without going through the thorough process, and that's what did happen. And that concluded that disagreement and a recognition and even an apology from the person to me, saying that behavior was not correct. And I said, you know what, let's move on. So that's one particular instance. I would do my best first to assure each of you at the department that I come with an open heart and I care and I want you to feel comfortable. And I will do whatever I can to communicate and to work with you in a way that you're comfortable. Because Dr. Smith, as you know, everybody has their own way of feeling comfortable. So it's important for me to understand in what way they want to be communicated with, how they want to be communicated with, and that I open up those channels and also get assistance to make sure that I'm not missing something. So one-on-one, program by program, I will do that. And even more importantly, open up a way so that there's a pathway where we have an ombudsman specifically, which we don't seem to have in that description, where if there are other concerns that may not rise to this level, even smaller ones, that they get transmitted and I can review them quickly and address them. I think that was really what was missing here in this right now. And I think that we can learn from this and be a much stronger place, a safer place, a healthier place where not just this one incident can serve as a way to heal all relationships. Because you know, Doctor, that there are constant conflicts among organizations at all times. So it's not just me as the director. What if it's another supervisor, another person? There needs to be a way to channel these concerns more quickly so that they can be addressed, so that people don't carry it and it doesn't fester.
I have a question. I have a two-part question, actually, Dr. Caldwell. The first part of the question is, do you know the percentage of women in the department?
I know approximately that it's 80%.
So 80% female staff in the department make up the public health force. Why should 80% of the workforce who have who can possibly identify with your admitted actions and the impact, why should they trust you?
Well, I work one-on-one with every one of them, and I can tell you out of our 700 employees, I know at least half of them that I work with regularly. And they had a chance to talk to you also. As they talk to me, I think you'd hear that they do value me and trust me. As I was just walking to my office, two of our most proactive employees who are part of our programs I wave to every day, said to me, "Yeah, we need you, Dr. Caldwell. We value you so much." And I said, thank you very much. And I think there are so many voices across this department that feel very much that same way. And I am so sad that there are the people in this report that have felt this way. And I want to make everyone feel connected, positive, valued, nothing less.
Any other discussions or recommendations?
Well, I guess I'd just like to ask Dr. Caldwell his thought about the fact that you're describing what you're, I think, perceiving as deficits that you would like to have some remedial action or whatever. What is your thought? Does it seem strange to you that we would be a little bit taken aback to learn of all these behaviors and to have heard through the months about different kinds of situations, but particularly when this report has surfaced? Do you believe that it's true of persons who've been in a profession as long as you have? I think that is what is throwing me so much, is to try and understand how the lack of insight that you have described yourself as having could continue as long as it has. And that you're saying you have not been confronted about that before, but I would just ask you, do you understand why we would have some real difficulty with it?
Well, I think it's difficult for all of us, and there's no doubt that I was completely taken aback by this. I think that if I had known that people felt this way, I would have had addressed it immediately. I do know also that in my proposal for the organizational chart, that is what precipitated, I think, a lot of the consolidation of some feelings that, these actions that I have been proposing for your consideration were evidence of some kind of feelings that I had. And I think that probably triggered this to where we are right now. And I sincerely apologize to those who I have who feel and that I have caused these feelings and have caused harm. And that's not who I am, and will not stand for it.
So, Dr. Caldwell, can I just ask you a clarification what you just asked, or what you just stated? So, are you saying this is retaliatory towards you? Is that what you just meant by what you said?
No, I didn't say that. I think I just noting the timing, that's all.
Please go ahead.
Yeah, I really have, and this may not be the time, but a process question. I mean, we're asking questions here, and the only opportunity we have to discuss this, obviously, is this meeting or a subsequent meeting. And we have to get rolling toward some kind of a plan, something to go forward with, whatever that may be. Are you going to lead that discussion? I mean, I don't feel like we can leave this meeting without having some sort of plan in place to at least begin to address this.
So let me give some feedback, everyone. Okay, so thank you for that. I assume that was directed towards me, David. Okay, there you are. So here's what I think as a board, we have the options of. Okay, so I want to, and thank you for bringing that point. So there are a couple of options we have as a board. There are these HR recommendations of actions. I mean, I think we've all read the 15 or so page report, and I've outlined some of what HR suggests are options. There is. There is actions that HR didn't recommend that could be remedial, if you will, my words. The other actions, I think if I think we have to put this on the table is there is Dr. Caldwell's contract that does have certain statements around actions that may be may be problematic for a board, and I can go through, the termination section if that, just to put it out there, section 5 of his contract, which would have, Dr. Caldwell does have a contract until I think March of 22. And in this termination section with cause, the 5 categories in which this may happen are fraud, and I believe everyone has a copy of the contract. So A is fraud, misappropriation, embezzlement. B is being convicted of or pleading guilty to a misdemeanor involving moral turpitude or a felony. C is violation of director's duty of loyalty to the board. D is continued non-performance by the director of his responsibilities, here and now, which has continued for more than 10 business days following written notice of such non-performance from the board. Or E, engagement in conduct that did or will, in the reasonable determination of the board, result in injury or reputational harm to the board. There's also the director, Dr. Caldwell, has the right to terminate this agreement without cause upon 60-day written notice prior to the board. So I guess I'm laying out the full gamut of options from. Well, and then there's the option of doing nothing, right? Accepting Dr. Caldwell's apology and moving on. So everything from that to a pretty extensive list of remediation options that I believe Metro HR has laid down. Dr. Caldwell very thoroughly put out, to the final action if the board deemed it fit any of the 5 clauses I put in here. Of termination. And so there's no rules of engagement per se of what one should or should not do, but those are, in my opinion, the options. And if there's one that I didn't mention, somebody thinks when you discuss, Mr. Smith or attorneys here, and so that's where actions are. And then the other action, of course, is a continuation of this conversation to another meeting. Anyone's welcome to motion for anything in regards to this report as it's on the docket. Thank you.
Maybe I'm being a little precipitous here, but let me just throw this out. I'm sitting here listening to this, and it's an awkward and difficult thing for all of us. And I'm thinking, well, we're not really going to do a termination thing in all probability, unless somebody has some strong feelings about that today. On the other hand, this cannot be not attended to or addressed. It strikes me the real core issue is, what are the remedial things that we would recommend? What is the time frame that would be involved? And what would be the metrics that would be involved to assess that? And it strikes me that's our duty as the board in terms of responding to this stuff. Just my 2 cents worth.
Well, one of the big concerns is, I'm sorry, David, go ahead.
Go ahead.
The clause that speaks about harm to the board, and if it's harm to the board, then it's harm to the department in many respects, I would think. So that for me, given the depth of concern that exists, I agree we could not make a definitive decision tonight, but I do think that we have to be really careful about being aware that we've got a lot of responsibility to Dr. Caldwell to be fair and just and comprehensive in our thinking and our actions, but we also have that responsibility to the workforce and to the community. And so when you start laying all that out, to just say, okay, these are the actions that need to take place, because I think there's harm that's already been done. And so if it's remedial, can those remedial actions on the part of Dr. Caldwell undo the harm, and I'm using the terminology harm, undo the damage, if you will, that is created now, not just within the department, but within the community. Therefore, it does seem that if we can look at all the options and 6 people on this board feel like we can come up with a definitive suggested plan beyond the remediations, I think that's fine. But otherwise, I don't see how we can make any definitive decision tonight at all. And I don't have the answer to then what is the next step. But there's just too many unknowns still. And unfortunately, there's too many knowns to just say, okay, we realize you're sorry, Dr. Caldwell, and so we can move forward. I think there's got to be some kind of understanding, as David said, and I think you just said too, Dr. Caldwell, a very specific criteria and time frame that we're talking about.
So may I say something as board chair? I didn't acknowledge this in my remarks. And you know, in this capacity as chair of the board, as well as kind of a more public role than I think a lot of my colleagues here. I mean, first of all, I think we all received a letter signed by 21 members of the Metro Council an hour or two ahead of this meeting, which was pretty direct. Dr. Caldwell, I suspect you saw that letter as well. I brought up my earlier kind of more public face in that I've also been reached out to by people, some citizens, some colleagues in the health department, that there's a lot of concern. There's a lot of concern about how this board operates, or how it may operate, and if we take an action, if we don't take an action, it demonstrates a concern for all of the department, but as Ms. Franklin highlighted, 80% of our department are women. But again, I think, you know, it's critical. I'm worried about how any remedial action would actually, I said, was measured, but it really wouldn't be effective, right? I mean, we're at a time with this crisis that as chair of the board, I don't think I'm doing my job right if we set up a situation in which we have an exodus of people, but more likely than not, women who are maybe younger, who maybe risk being pregnant. I mean, risk is the wrong word, but become pregnant, like worry that being pregnant would result in an issue with their job. That gives me the greatest pause here, period. So as a chair of the board, whose obligation is to ensure that the board conducts its business appropriately and with honor, and thus by proxy make sure the department does the same, I have a lot of concern about the reputation of the board currently, if nothing is done. Thank you.
Yeah, and I still have some concern. I kind of alluded to it in the question that I asked, but about retaliation specifically, because that was one of the things in the report that was mentioned specifically, and the different forms of retaliation that can occur, be it demotion, shifts in jobs, exclusion from meetings, things of that nature, and it not really being acknowledged, at least to my satisfaction. Those kind of things erode the confidence of those working. And right now, during this pandemic, we really, the confidence of those working is about as important as just about anything else. I would like to know more about how to protect those who in the future may have some kind of grievance. And I think the mention of an ombudsman is a good idea, but I still have concerns about how people would feel about future instances and wanting to go forward with talking about these kind of things if we, and I think we all agree we're not going to not take action, but I think that, action needs to be taken with due diligence, but sooner rather than later, in my opinion.
Yes, it seems to me that the contract clause where making the director aware of their failure to perform their job as we expect it to be performed should occur now, because we need to identify this, and we can then have, it can't be 10 days, 7 days, some number of days that some designee, be it HR or someone, work with Dr. Caldwell and come up with what might be a plan that could show that those changes have occurred. And at the end of that 10 days, we either agree that that plan is sufficient and we give him the probationary period in which to do that, or we say at the end of that 10 days that it is not sufficient. And then that's, to me, it seems that we've got to get that ball rolling somehow so that some action is being taken. And if we don't do that, we're going to continually be in this cycle where we don't kind of come to a decision. And I'm not trying to take away your ability to make those corrections, but I think we have to have a very specific timeline, and we need to do it as the contract states so that we can move forward.
So my comments are not in line with, or are not in line with, let me just take a step back. Over the past, since my tenure, since I've been on the board, and particularly over the last several months, I've had an opportunity to get to know our rank and file workforce. I've also had an opportunity to sit in dialogue with Dr. Caldwell and provide suggestions about interacting and getting to know team members across the department. I think what Dr. Caldwell shared today with regards to working closely with over half of the individuals in the department and knowing them well and them knowing him well and expressing value of his presence in the department, I think he might have a different understanding than a good amount of the workforce, particularly those that I have encountered and have had conversations, particularly on getting to know Dr. Caldwell. I also am concerned regarding the statement that Dr. Caldwell made about the 3 individuals in his cabinet that he said report to him and were not interviewed in the report. they are not full-time employees of the department. In the proposed org chart, I'm concerned about the fact that the women are individuals, rather, that are on the witness list for the fact finding for the report, including Ms. Franklin, that it appears as if there will be a demotion. And those were individuals that may not have been in line with or in agreement with some strategy or strategic decisions in the department. The HR report issued regarding complaints levied against Dr. Caldwell are troubling. In the report, there are accounts of his interactions with men and women being seen as different, and one could draw the conclusion that some of his actions could be the result of implicit bias or unconscious bias. Then there's the incident regarding Ms. Rachel Franklin's actions being called into question by Dr. Caldwell because of her pregnancy. The report indicates that Mr. Brian Todd and Mr. Hugh Atkins have also had heated exchanges with Dr. Caldwell within the scope of strategic approaches to the pandemic work, yet his responses to those heated exchanges were not the same as his response to Ms. Franklin. This is troubling, but particularly so because her pregnancy was introduced by Dr. Caldwell, her supervisor. He skipped over expressing understanding, reprimand, and civil service rules to propose termination and/or removal from her position. This was not reported to have occurred with Mr. Brian Todd or Mr. Hugh Atkins. Given the details outlined in the report, I believe that the board and Metro Nashville government could be at risk for being named in the filing of an EEOC violation of the Pregnancy Discrimination Act, which is the amendment to the Title VII of the Civil Rights Act of 1964. Now, while Title VII states that this law makes it illegal to discriminate against someone on the basis of race, color, religion, national origin, or sex, the law also makes it illegal to retaliate against a person because of the person complained about discrimination, filed a charge of discrimination, or participated in an employment discrimination investigation or lawsuit. The Pregnancy Discrimination Act makes it illegal to discriminate against a woman because of pregnancy, childbirth, or a medical condition related to pregnancy or childbirth. The law also makes it illegal to retaliate against a person because the person complained about discrimination, so forth and so on. We have to consider what message our actions as a board sends to our public health workforce, which we mentioned already is 80% female, according to the Metro HR website. We must consider what message our actions send to the residents of Davidson County, who look to us to uphold public health orders and protections. We must consider what our actions send to the members of the City Council, many of whom have expressed that the best course of action is for Dr. Caldwell not to continue as director. Now, we could require implicit bias training and perhaps diversity coaching that Dr. Jahanger outlined before as recommended by HR. But based on the verbal interactions documented in writing from the council and media reports dating back to June 2020, I wonder what the likelihood is that Dr. Caldwell will change his behavior. Based on his verbal interactions with us as a board, do we think that he will change how he communicates with us? If Dr. Caldwell were to remain in this position, our workforce would lose confidence in us as a board. If Dr. Caldwell were to remain in this position, we as board members could be at risk for recall by the City Council. Our credibility in being the oversight body for the Metro Public Health Department will be called into question and has in a lot of the media comments I've seen on social media, the general public and potentially the media. If Dr. Caldwell were to remain in this position, what type of message will we be sending to our sons and daughters? If the agency head should be the one that models the appropriate behavior for the rest of the department. We would not condone this behavior from the rank and file. I don't think it would be prudent for us to condone this behavior from the department, the director of the department. I'm not sure. I'm not sure that Dr. Caldwell at this point has the competencies that we need in a leader for the department. I'll stop there.
Ms. Franklin, it sounds like you're proposing immediate termination. Am I hearing you correctly?
You broke up, Tanae. I'm sorry, you're muted.
Okay, I was trying to come off mute. I value the board and how we deliberate and discuss and pressure test and examine from all sides. We had 2 months of the investigation. We have had our experiences over the several months. We've had experiences that council has communicated to us. I didn't sleep well last night, and I'm not the focus of this, right? There are other individuals, the people in the department, the complainants. I would imagine that they're probably not sleeping at night. And I just don't know how we as a board could allow the leader of an organization to continue in this position if we know that our workforce is going to lose confidence in us and will not have gained confidence in this particular leader. I just don't know how to rectify that outside. I don't think unconscious bias training or coaching, I don't think that is enough for our workforce and for the residents of Davidson County. When we should be leading with health equity. And health equity means gender equity, it means racial equity. It means addressing social determinants of health and systems change. That's what public health stands for. And for us to not have a leader at the helm that champions that and models that is problematic for our work in public health. And it's problematic for the impact of the pandemic that impacts women disproportionately because they're the ones that have to stay at home or they're the ones losing jobs more so than men. That's where I stand.
So is there an option to just not necessarily make a motion, although I suppose we could, but Dr. Caldwell, some of the correspondence that we have gotten, if we take that and we take much of what Tanae has just said and just across the board, if we believe that it was in the best interest of the department and of the community for you to step aside, what would be your response to that?
I would ask that we not be driven by headlines, but you as the board members provide me the fairness to look at the specifics of the report and the findings. There are statements that were made that did not correspond with actions. For example, although I thought of a number of possibilities in my discussions with HR and my management team about taking certain actions, I feel that as the director, I should be able to think through what options to pursue. And I chose to not pursue any options in regards to that one incident. So there was not any specific action taken, except the action was that there was to be no action. So similarly with the other colleagues that there was difficulty with, I thought of a varying number of remedies, and I chose those that were more compassionate and to look at the stress of the situation and to get a more of a thoughtful recognition of what had occurred to make sure that they were safe and healthy and that they recognized that their behaviors were inappropriate, and we moved on. So in no case have I ever taken action on anybody. I have not demoted anybody. I've made proposals.
Dr. Caldwell, you've been quite specific about your actions or lack of actions in different times. But the overarching issue that we're hearing and we're seeing is a lack of trust in your leadership. And if that is the case, then I think there may be some time here that we would like for you to look at your options so that you don't feel that we're not listening to you. But we have to listen to everyone here. That is our responsibility. And the lack of trust that I think has occurred, and I don't know that however much remediation, I don't know that that's going to build it again. And so if, and I asked my other board members, it seems to me that it may be reasonable to provide some time that Dr. Caldwell would come back to us. And I don't know where the 10-day thing comes from, but that may be a reasonable time or some other period of time, but a short period of time in which he comes back and gives us a response as to what his plan of action is, up to and including consideration of stepping aside.
Carol, I do think that your suggestion is similar to where I was going with my conversation, and that whatever the time period is, to give us a little room to work to a better decision. While we have known some of these facts, much of it has only come to us this week, the actual documentation, some of it even today. So to take a definitive action today might not be as prudent as it could be. But to take no action today is definitely not the thing to do. And it seems as though if we were to put and I said the 10 days simply because it's in the contract, that we give the notification today that there's a lack of trust in the leadership, along with the other issues that have been identified in this complaint. Spell that out as failure to meet the duties of the job. Gives us time for Dr. Caldwell to consider his options, as you said. Gives us time to consider our options, and then we will be taking action in a short period of time, but it wouldn't necessarily be today.
I just want to maybe make my position very clear. I worry that without a clean slate, we cannot regain the trust of the women in our department and the men. And I respect what the board is decision will be, whatever that is. There's been no motions, but I do, both as one of the longer serving board members and the chair, just want to verbalize that and as we deliberate further. Thank you.
So, Mr. Frederick, you're referring to in the contract section 5, letter D, around regarding continued non-performance by the director of his responsibilities, here under which has continued for more than 10 business days. Is that what you're referring to? Or are we considering the clause, which is letter E, engaging in conduct that did or will, in the reasonable determination of the board, result in injury or reputable harm to the board?
I was speaking to D, and I see where you are going to E as well, because there is perhaps some harm to our reputation. I agree with you totally. Right. I'm talking about D, where we put him on notice, Dr. Caldwell on notice, that the behaviors that have existed, the things that have created the lack of trust, the combative communications, those things are not acceptable. what can be done to correct those. It may be nothing. I don't know that there is a solution to that, but it does seem to me that this is, in addition to perhaps harming the reputation of the board and the department, that Dr. Caldwell is at present not conducting the job the way that he should be conducting it, in our view, based on the conversation that we've had today. And that's why I landed on D.
And so I'm just curious, what in your mind, and this can go to any of the board members, what in your mind would you recommend, knowing all the details and having the experience on the board thus far, interacting with Dr. Caldwell and working with him, what would be sufficient in your mind in order for Dr. Caldwell's behavior to change and for the likelihood that trust would be gained across the department and in Davidson County?
I think it's an uphill battle. There's no doubt that it is. So I don't know what it would look like exactly, to be honest.
And do you have any idea how long you would be willing to wait for a result? So would it be a month? Would it be 2 months? I'm just trying to get an understanding.
Sure. It would certainly not be any greater than 60 days, and probably less than that. I would really like to see a well thought out proposal of how we're going to get there, as opposed to just there are these classes that I can go to, there are these things, but we don't even have any metrics. So the first thing is to put all that together. And I think Dr. Caldwell needs to think about, as he's putting that together, he needs to think about, is there any way for him to succeed? I mean, he's heard us say that it's going to be very difficult to regain the trust. It's going to be very difficult to regain our trust, much less those of the employees of the department. So I guess as much as anything, it seems as though this period gives Dr. Caldwell a time for reflection to determine whether he believes that he can meet our expectations and do the job, or whether he wishes to step aside. So I guess just to get the ball rolling, I'll put a motion on the floor. We can start it if we wish. And my motion would be that we issue the notice failure to perform today, and that we expect a plan of remediation to be presented within 10 days. And we would then look at that very specific plan and make our decision as to whether we find it acceptable or not, which would mean another meeting between now and Christmas.
All right, that's a motion by Mr. Frederick. Is there a second for that motion?
I second it.
Dr. Smith. Okay, any further discussion around that motion?
Could I ask a question? If that motion were to pass and we're talking about 10 days, does that mean a called meeting in 10 days? Or how would we do that?
I think we would have to, because we'd have to discuss whatever and there's no other way to discuss it, but have a called meeting.
Yeah, that'd be a call meeting. I will tell you, I mean, I will just, again, in discussion, I will vote against this motion because I don't know what is going to happen in 10 days. It's going to rebuild the trust of our employees. I mean, I'm not saying this what the rest of the board needs to do, but I just want to be very clear in the discussion portion. Any other discussion regarding this motion? Because that's where we're at in Robert's Rules.
I agree with that. I don't think 10 days is an arbitrary number. I don't think that there is going to be trust in the department, and our workforce is is top of line. Without them, then we cannot fight the pandemic. We can't do the public health work. And I'm concerned about the message that it sends to them.
Okay. Any other discussion on this motion? All right. Hearing none, I'm going to take a vote on the motion that Mr. Frederick put on the table. I'll start with you, Mr. Frederick. I'm just following my order here.
Aye.
Okay. Ms. Franklin?
No.
No, sorry. I can't roll call right. All right. Dr. Smith?
No.
All right. Ms. Effington?
No.
And Dr. Campbell?
No.
And I also vote no to this motion. So that's 5-1 no. So the motion fails to carry. I open up the floor to more discussion. Yes, Dr.
I have one concern that if we have to do something, we have to respond to this. If you have a employee that is not performing up to standard, isn't one obligated from a legal perspective to give written notice and tell them what to expect them to do better at to make sure that the termination works?
Well, I will defer that specific question to Mr. Smith. I will say that under this, Dr. Caldwell falls under the contract. But regarding your specific question on employee, Derek, would you have better insight for us?
Yes, to Dr. Campbell's question, if it's an employee at will, no notice, prior notice is required. If there are other circumstances, it can create a requirement for notice, Dr. Campbell. So again, I can't give you a blanket answer in that regard, but Dr. Jahangir has correctly pointed out, in this matter, Dr. Caldwell entered into an employment contract with the Metropolitan government, and it has provisions that are contained in paragraph 5 in that document with respect to termination for cause. I appreciate your question, but I don't know if it's applicable specific to this case. Although I will say, to the previous motion that failed, to the extent you're talking about advance notice, that's what that provision dealt with, 10 days notice to improve with respect to the deficiencies. That's where that would fall under this contract's language anyway. That concludes my comments unless there's further question or request for any clarification.
We have no obligation to notify or suggest remediation. Just want to be clear about that.
Again, if you review the contract, the provision that Mr. Frederick's motion was based upon is one which provides for notification of deficiencies in a 10-day period to cure. That's the one provision that requires prior notification.
Okay.
The other provisions do not state that they require prior notification.
I wonder if other people have some suggestions of what we should do tonight then.
Well, it seems to me that there are two, from what I discern, two options. One is to, if it's possible, to give a period of time that Dr. Caldwell would have to reflect on whether or not he would like to step aside or would be willing to step aside. And or the other is to make the case for harm and or injury to the board, and therefore everything the board represents, like the workforce and the community, and to vote to terminate. What I'm not sure of is whether, and Derek, this may be a question for you, if we took the latter step, do we need to have time, though, to, in fairness to ourselves, but certainly in fairness to Dr. Caldwell, to lay out the specifics of why that request for termination is being made? Or why termination is being suggested, I should say. It's not a request.
So,
It took me a moment to clear the mute. Dr. Jahangir, do you wish for me to respond? All right. To the question asked, the board has the discretion to not make its final determination tonight. It may take some action here tonight, pending further action, and therefore have an opportunity to lay out criteria that it wishes to express whenever it would convene in its public sessions at a later time. During that time period, though, again, you need to only deliberate and contemplate those further things when you come together collectively, and that's where you would express them. But you can all, of course, individually reflect and determine other things during that period of time. So to answer your question, that's as specific as I think I should get without revealing
thank you.
Your thoughts for you.
So I will say this. I mean, I think this is an extremely hard conversation that in any situation, much less a public situation. But I think as a board, we have an obligation, as I've said, to make sure reputation is done. I also respect what, you know, I mean, I think we need to recognize, you know, Dr. Caldwell in this as well. And one could, I'm not at this moment making this, can make a motion for termination and perhaps all obviously unpaid benefits are paid, and perhaps a month or two of salary to allow for, you know, some transition. I mean, that could be a motion that can be made right now by us if we so deem to be the case. I still stand by the statements I made earlier, but I just want to put that seed in people's mind that if that is an option, one could choose to at least allow, you know, that option. Thank you.
So Alex, so what you're saying is that you would what you're saying is that a motion can be considered that allows for some type of severance?
Yeah, I think, you know, I am saying that. I think, yeah, I mean, that's exactly what I'm saying, that if you know, yes, I mean, that's, I think as a board, we have that, we're an independent board, and we have that option if so deemed. I'm not saying that's what we do. It could very well be that you terminate without severance. It could be that you don't terminate. It could be any, I think no matter, I'm just laying out some potential options here that as just throwing out there. But Derek looks like he needs to say something.
Mr. Chair, I want to pause for a moment and just think through whether or not additional payments, though you have the independence to request that, I'm contemplating that may require council action to appropriate those funds and so forth. I don't know that your decision.
That's fair. Thank you for that clarity. Then I withdraw my statement if that's a council action.
Dr. Jahangir and board members, I'd just like to suggest also that if transition is what is moving towards, that we also look at providing the smoothest transition possible. And I certainly have a lot still to offer to assist in that. And I'm happy to try to work with you and the team to make sure that there are no unintended consequences based upon all the partnerships and knowledge that I give. And perhaps if I were not to be here, it would impact other areas of the department that may not be apparent. And I think it's something I want to express, that I want to make sure the board is aware that I want to be provide the best for the department and the community, and that there is a plan that's best for everybody.
Dr. Caldwell, after having heard this conversation, and quite honestly, I'm hearing an awful lot of skepticism about your ability to meet the expectations of this board. You are now speaking of a transition period. It's your decision to make, but the easiest way to have a transition period would be for you to initiate that.
Yes, and I want to do what's best for the department and for the community, and that the board would agree to. But I don't think I could say at this moment what that is without being able to think through specifically how that might work, to be able to assure that everything moves smoothly. So if I were able to have, let's say, those 10 days that you suggested, to be able to provide me an ability to talk to the staff and gather the proper information to provide to the board some proposal that could be considered.
I have confidence in our bureau directors that they would be able to continue on with the work essentially without missing a beat if needed. They work well as a team together, and I have confidence that they will be able to make sure that the transition is a smooth one.
I guess I sort of feel like somebody else is starting to suggest something here.
I mean, so for purposes of discussion, and you know, I place a motion to terminate with cause.
Yeah.
So what I heard, Dr. Smith, you said you make a motion to terminate with cause. And Carol, are you speaking? I'm sorry, not Carol. Tanae.
I would like to offer a friendly amendment at the appropriate time. So I should make a second?
Well, I would think the more proper thing would be that nobody seconds this, or you could just bring something up, or whatever. I don't know. Just bring something up, and then we can maybe amend it, and we go from there.
Okay. I support the thought that I'd like to make it specific to Section 5, Section 5, letter number 1, letter E, for the reason engaging in conduct that did or will, in the reasonable determination of the board, result in injury or reputational harm to the board.
I accept that amendment.
So there is a motion for termination with cause as Section 5E. Okay, and that's from Dr. I guess Ms. Franklin, and seconded by Dr. Smith. Is that right?
Yes.
That's correct.
Okay, I'll open the floor for discussion.
What does that mean in terms of, maybe there's not an answer to the time frame of that? Do we have to have some specific plan ourselves as to a termination plan? Or
is there an effective date that you're suggesting? Is it today? Is it, yeah?
I'm suggesting that immediately. And I also know that we have our board retreat tomorrow, which I believe ELT will be part of. So that would afford us an opportunity to continue to talk amongst ourselves as a board as to what tomorrow looks like. But I am recommending termination immediately.
And I just like to say, you know, it seems to be for E is reputation, and our interpretation of what reputation is. And one could argue based on the information that we've received today from the public, from our council members, et cetera, that's demonstrative. I'm not, you know, by any means a legal expert, but I think that, you know, I think that we should consider that in our decision.
And I would just add that any, obviously, unused vacation, et cetera, with normal HR things about whatever would be due to Dr. Caldwell if this vote carries should be honored. I think that's appropriate.
Alex, could you just repeat what you said? I'm sorry, I didn't understand specific.
Yeah, I think what I'm saying, and I may not be wording it well, and I see Mr. Diamond's on, he may be. So in any situation, when anyone's terminated with cause or fired out of the department, any unused vacation, any benefits that he has earned, I want to be very clear, goes to Dr. Caldwell. Is that, Mr. Diamond, am I verbalizing that right?
Yes, sir, that is correct. Any unused vacation / annual leave would be paid out to any employee upon termination.
Anything else that we need to know? Because I honestly don't have a clear sense of what there's anything else that would be due here.
No, employees aren't entitled to be paid out for sick leave. And again, I would have to look over his contract to see if there's anything else in there, but as I recall, there was nothing else in the contract that would cause, any different compensation. So yes, he would be paid for his remaining annual leave balance.
Thank you. Any other discussion regarding this motion to terminate with cause? Yes.
I'm a little concerned about doing it right away like this. Are there unforeseen things that we need to attend to? We're changing horses in the middle of the stream here a bit in terms of COVID and things like that. Are we going to have any unforeseen consequences that we need to think about before we do this?
I think that's obviously a really great question. I will say I think that tomorrow with at a retreat, I think Derek and I can talk, but I think there's a way I may amend the agenda or may fit under one of the agenda items already to talk about it. I think our bureau directors have been very involved with different parts of it. I think there is, I've been very involved with the COVID part of it. I can't speak to the rest of the department per se. So, I mean, I don't think anyone in good faith could say no with certainty, but I feel like we have a pretty good basis of people around, but nobody can ever answer that question with 100% certainty for you, Dr. Campbell. I'm sorry.
That's just the concern I had in thinking about this.
Yeah. Any other discussion? Dr. Caldwell, anything you want to say before we vote?
Yeah, only that I'd like to provide you with the best transition that I can. And while I understand that you may want to start with the retreat tomorrow, I would ask that there be at least some opportunity for me to be able to appropriately transfer any information and things that I have, and to maybe consider a 30-day time frame to set it for, but it would be, based upon whatever specifics that you set, but it would enable us to assure that whatever information I have could be, properly provided without there being any delay or gaps.
Okay.
Could those specifics be discussed tomorrow, or do we have to make them concrete tonight?
No, I think we will discuss it tomorrow, Carol. I think you're talking about what potential plan for, is that what you're asking?
I don't know why I'm having a hard time understanding what you're saying, Alex, but I'm just saying, do we need to, if there's a belief that we are in accord with the decision of termination, then if there is a transition period, can we work through that tomorrow during the retreat? Or do we need to define it tonight in terms of what the transition period should entail?
The motion on the table is immediate termination.
I guess, Dr. Jahanger, I have a question.
Yes, please.
Yeah, I mean, if there was this alternate resignation option, how would that be considered or not at this point, I guess, since you have the motion on the table?
I mean, we haven't voted. What are you thinking?
Well, what I was thinking, a certain number of days to then be able to, assure the board the direction that they want, and that I will be able to provide all of the information in an orderly way. So
are you offering your resignation, Dr. Caldwell? If we said maybe I don't know, 3 to 5 day period of transferring information. I mean,
my proposal would be 30 days, but that would not be that would then provide the leadership to be able to readjust here.
Yeah, I'll tell you, as board chair, I would welcome your resignation. I'm not comfortable with a 30-day period. I appreciate your willingness to work with a transition of, I would honestly say a week. That I feel comfortable with that, but I think that I appreciate your willingness to do that. That's what I would feel comfortable with if you so were willing to do so. And my board members, we still have a motion we have to vote on, but I haven't forgotten that. But I would welcome your resignation with a shorter transition period I appreciate your willingness to help with that transition and stuff. So
given the specifics of what we're facing, I would say, December 31st, and then that would be my proposal. January 1st. I mean, that because especially given the holidays.
Sure. So I would. I hear you, Dr. Caldwell. I appreciate that. I would feel comfortable with a resignation effective. This is again just me and you speaking with everyone around me. This is me just talking, but I think a December 18th date's the longest I would be willing to do this personally. But I'd welcome the rest of the board giving me their feedback. But I'd welcome your resignation. It'd be a clear way to do it. Yes.
So what if if the resignation were to be effective the 31st, but the time in the office and actually in the position ends on the 18th? So there's pay through the end of the month, but there is not presence in the office.
I guess I'm still not clear on why there needs to be time that Dr. Caldwell remains in the office. I'm not clear on what needs to be transitioned that our executive leadership team is not able to handle. And with what you asked, David, I would support him being part of the department until December 31st, but not being in the office and not functioning in the role of the day-to-day for director.
Yeah. That leaves the office as of tomorrow.
And that perhaps, Dr. Caldwell, that expectation then, if I may just add on to what you all are saying, and there still is a motion that I haven't forgotten, that expectation would then be that anyone reaches out to you with a question, you from remotely close off anything you need to hand off. It gives you a few weeks to hand off, but effectively whatever transition we incorporate, which will probably be discussed tomorrow, would then be implemented, and you would serve as kind of an advisory role until the end of the month. I personally would be comfortable with that if that is your offer of resignation. But again, effective essentially tonight, you would not serve as director of health. I'd be comfortable with that if that's what you're saying, and then we'd have a discussion. If you're comfortable with that, I'd like to take a vote on the motion that was placed. And then maybe consider what you're saying. Would you be comfortable, or do we how I just verbalize that?
Are you asking me?
Yes, sir. Would you be comfortable submitting a resignation? Again, we have to vote on the termination here in a minute. Would you be comfortable submitting your resignation, essentially effective tomorrow or tonight? You're no longer director of health, but you would serve in any capacity for advising the transition that we'd implement. But you effectively would do that remotely until the end of the year, and you'd be employed by Metro Public Health at the end of the year. Would you be amenable to that?
Yeah, I want to assure there's proper transition, and I think there's. Today is Thursday, so I would say it's important that. All of my knowledge and contact get properly transitioned. So
and I think the key here though is we have to be very diligent that you would you'd respect respect any property you have, information, and so forth. I mean, the expectations of that you wouldn't. Just make sure that information is shared on. I mean, you essentially would be off campus. You would be available in an advisory capacity. So if you'd be amenable to that, can we vote on the termination motion that was made a minute ago, and then we can come back to this discussion? Would that be fair?
Dr. Jahanger, just as a point of order, we can withdraw the motion as well, if that's something that we can agree upon.
Well, Ms. Franklin, I believe, made it, so I would leave it to Ms. Franklin, or you can withdraw your second. That's both accurate.
I'm willing to withdraw the motion to consider the proposal for Dr. Caldwell to offer his resignation.
Thank you. Now, Dr. Caldwell, would you be willing, and I need you to verbalize this, would you be willing to submit your resignation, effectively stopping serving the not coming to office, not being the director as of tonight, but serving an advisory role till the end of the month remotely? Would that be amenable to you?
Well, yes, just with the practicality of needing to, deal with some office issues. So,
meaning what?
Well, things that I have that I want to make sure. For example, in an advisory role, you're saying electronic communication, all that, I'd be able to make sure all that gets transitioned appropriately.
I'm not sure I understand what you're saying. I think what I mean, let me be clear about what I mean. You're offering your resignation. You are, if any of the transition, at whatever plan we put forward, until December 31st, you will be on the payroll of Metro HR, of Metro Health, and you will serve at whenever advice is needed, any information is needed, we'll reach out to you. Whoever's in the transition will reach out to you and ask. That's what I'm saying.
Yeah,
that's what
I'd like at least for tomorrow, the Friday, to come in, to be able to have access to the office, to be able to take care of this, bringing things out or things like that, just to be able to do that.
I mean, I'm comfortable. Anyone have any thoughts around this?
Maybe like 5 o'clock tomorrow. I mean, I'm just trying to come up with something that would make it so that I'd be able to have the ability to,
I would defer to Jim Diamond on what the procedure is when employees leave the department.
That was what I was going to ask. We have network access, for email. We also have phone, badge access physically to the building. So these were questions I was going to bring up. So I'll need a date and time to disable his network access to email. Like I said, his cell phone, any other electronic means we have, as well as to disconnect his electronic access to the non-public areas of our buildings. And so that's standard with any employee who's terminated, but this is kind of an unusual situation in that we're suggesting different times of consulting and things. So
here's what I think. I would be happy to make a motion to accept your resignation effective today. You can come in tomorrow to your office, and then I would say, at the advisory role of whoever would want to contact you can contact you. Our ask would be that you respond to questions, but I think badge, email, all that should end effective today. That's what I think would be a fair resignation.
I thought you were saying December 31st. No, that's why.
You would be on the payroll of Metro Health till December 31st, and the expectation would be that anytime anyone in the department communicates with you about something transition-wise, you would work with them in a respectful and appropriate manner.
But for that, I'd still need to have access. That's what I'm saying. I mean, if the email access I'm suggesting and those things should conclude on December 31st, because otherwise that's what I'm suggesting. Because how will I be able to communicate them?
I mean, we have your cell number and you have knowledge and you have that's how we'd be able to communicate. I'm very clearly, I think, stating that I'm not comfortable with you having complete access to everything at Metro for the next 3 weeks. And I greatly value your willingness to be of support, advice, your knowledge that you may have, etc. I'm trying to come up with a resignation here that would work beneficially for both of us. So that's where I stand on why I'm trying to be as clear as I can here.
Jim, is it possible that the only access would be email and no access to the network otherwise, or is it all or nothing?
No, it's all or nothing. We could restrict his access to some shared drives or files and everything, but he'd still, once you're in the email, you're on the Metro network. So it is kind of an all or nothing. I mean, we can lock down some things, but not everything.
So Dr. Caldwell, I guess that's, if you're willing to resign with the stipulation, essentially you can clear out your office, be available by phone, and perhaps associate as an in-person meeting with whomever our transition is. We'd appreciate you staying on Metro Health Department until December 31st. If that is not acceptable to you, then I'm happy to make another motion.
Yeah, I mean, well, is there somebody else? No. I'd just like to be able to have the opportunity to do that tomorrow at the office, if that's acceptable.
I'm okay with that, with whatever guidelines typically will be placed with somebody in the office with you, as I suspect there's protocols for that. Okay. I guess, Mr. Diamond, I'm looking at you. Is that fair?
I'm sorry, could you repeat?
I'm sure there's protocols in place if somebody who's essentially leaving the office comes to clean up the office, take whatever he or she needs.
Correct.
So whatever those protocols are, I'm very comfortable with that for tomorrow. Personally, I can't speak for the rest of the board, but okay. So let me just one more time clarify what I've said, because I know we've talked a lot. If you're willing to resign and you're willing to do so effective tonight, with understanding you come back tomorrow to do whatever you do around the office, and you're willing to serve in a capacity, an advisory capacity to whomever reaches out to you in the department, however that person reached out to you, you'd be employed until December 31st, 2020. Would you be comfortable with that, Dr. Caldwell and Carol?
Well, I believe that is something that would be fine.
Okay.
There is a precedent, and it was just a general thing, not with regard to an individual, as it would not be at this time, but that if there were files that were being downloaded, there would be someone in the office with you to ensure. So for your safety and for the safety of the department, it can be documented on what files are downloaded. Jim, is that possible? I think we did it.
Yes. Anyone who does not have badge access to secured areas has to be escorted by somebody who does. So, and with them at all times when they're behind the secured access. So yes, somebody would need to be with him at all times while he was accessing anything on his computer, i.e. standing over his shoulder to make sure nothing gets downloaded onto a flash drive or emailed out or anything like that. So, and that's building protocol for anyone.
That is not personal to you. That is a protocol that around.
So, go ahead, TNA. Now I'd like to make a motion.
I was just wondering if a plan could be that, because I know both of you are at the office tonight. I assume, Jim, you look like you're in the office. Are you?
Yes, ma'am, that's correct.
Okay, so if Dr. Caldwell were to give you a badge and then come back maybe tomorrow after hours after workforce time to be able to clean out the office, but that is something that is continuable. Like I'm talking about an immediate for the work.
I apologize, Ms. Franklin, you're breaking up a little bit. Did you ask if we could make arrangements for somebody to meet him tomorrow after hours?
Correct. Immediately after work, after the work day. But Dr. Caldwell could give you his badge tonight, so he can't enter the building until come and escort him. Tomorrow, he gives him the space and time to clean out his office.
Yes, we can make arrangements. We do have the board retreat offsite tomorrow afternoon that's supposed to end right at the end of business hours. So I guess anyone who's involved with that couldn't be here right at 4:30, but we could make arrangements for somebody who is not, at the retreat to meet him here and take care of those functions. Yes.
Okay.
Okay, so I make a motion that we accept Dr. Caldwell's resignation, effectively giving up badge access and in-person effective today. Obviously, you can come back tomorrow as per protocol with Mr. Diamond, and that you will be a willing and available for consulting for a transition until December 31st, at which time your employment with Metro Health will end. That's my motion.
Second.
Dr. Smith seconded. Any further discussion around those two motions? Okay. Dr. Smith.
Aye.
Mr. Frederick.
Aye.
Ms. Franklin.
Aye.
Ms. Etherington.
Aye.
Dr. Campbell. Dr. Campbell.
Aye.
That's right. Is that aye? Aye. Okay.
Aye.
And I also vote aye. So 6-0, we accept your resignation with the terms, Dr. Caldwell. Okay. Thank you, thank you. So as far as the retreat tomorrow, we'll keep it as scheduled. I think under the org chart or under another section, we will discuss how we transition the department. And that's my report. We can talk more tomorrow. Any other business that, we can talk within reason. All right. Hearing none, I adjourn the meeting. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.